Here we go. Maybe this audio will work. Does that work? Okay. Hey guys, good to see you. Can you hear me now? Okay, good. Sorry, I'm still trying to learn what I fixed on my OBS the other day. Hello, hello, hello. How's everybody doing? Hey Rachel. Hey Bam, Lee, Emily, Katie, Yasmin, Tiana, Emily. Good to see you. Ashley. Is Mitz here? M-I-Z? Just curious if she's here. We got 20 of you guys on and 5 likes so far on the YouTube thingy. Thank you, thank you, thank you. Hey, Katie. Hello, Baltimore. You're testing tomorrow? Bams. I've got some info on the bottom of my Word document for tonight of some extra bonus stuff that I didn't get a chance to find the questions on, but they probably will be really good for you to look up really quick. Also, some of the questions I have tonight, pay close attention because I got them direct from someplace important. Anyway, Tia, let's see, Kanisha, yes, Maggie, Jordan, good to see you guys. Oh gosh, how's everybody doing today? It's a beautiful Tuesday. The sun is still high in the sky here. Hi, hi, hi. Is M-I-Z, your first name would start out with M-I-Z. Is that person here? Somebody sent me a big email tonight, and she's got a lot of questions about Codify, and AAPC is trying to push her to buy it, and I don't think it's very helpful for the CPC exam. Maybe I could do a live and show y'all what it does and doesn't do, but I don't think it'd be helpful for tonight, because especially with somebody going to take their exam tomorrow, I want to quickly get into our practice questions for tonight so that I can, before they go to sleep, we can make sure we go through those questions for tonight. But I just wanted to let her know I didn't ignore. You packed them up to make sure you had everything for tomorrow. Oh no, that's a good job. You were listening to me. I said pack it all up, go on and put it all in the car and everything. Just the CPT. Just get the CPT. You don't need the other two. Just get the CPT. Hanging in here. My daughter got a car accident and it's her 17th birthday. Aw, Katie, this too will pass. A lot of things in life have ups and downs. We got to be very thankful she's okay, I'm assuming, since you're here. Hopefully she can hang out with us too, and you can learn all about medical coding. Remember that if your income is below the federal guideline for, it's like, even if you have a household of 4 people, it's around $100,000 a year right now. If you make less than that for a family of 4, the hospital bills that they send you have to be 0 because of everybody that accepts any kind of whatever from the hospital, their payment system, they have to have a charity care. So if they're going to try to bill you for a ton of fees over and top of whatever, number one, put it all through the car insurance and have the car insurance pay for it. And then whatever the car insurance doesn't pay for, maybe your income will qualify for free. There's a lady on TikTok that helps people with all their medical bills and how to fight them and get them down to 0. She's pretty cool. I gotta put her link on my website. I saw her yesterday. So don't automatically start paying those medical bills. Anyway, it's my suggestion. But anyway, I hope she turns out just fine, and I hope that she doesn't take it to heart too bad. And you know, a lot of things happen, and maybe it'll be better on the other side. I'm hoping that I had a car wreck with the babies in the back seat, and we had, thank goodness, I had gap insurance, but I had to fight them on it, and I had to fill out a ton of paperwork, and eventually I got the whole car loan paid off. But it took a bit. It took a bit, and I still had to keep making my car payment even though I didn't have access to my car, so that was kind of a bummer. But eventually got it paid off. I hope it all turns out very well. I know today was probably very crazy for you. Let's get... Audio has to be so picky every time I switch screens. Sorry guys, thanks for letting me know. So we've got an obstetrics pathology report, and all we're going to do is fill in the blanks. This patient, Miss Bonnie, had a surgical procedure, and right here she had a right partial what? Was it a pregnancy? Ultrasound, fallopian, cassette, tube, atopic clots, microscopic, or the final word? What do you guys think? We're just going to fill in the blanks here. And so my cat is screaming at the door. Let me go let her in. What would go in the very first fill in the blank one right here? I have it grayed out. Can you guys see it? It's a right partial what? Good job, guys. Perfect. All right. What about our next fill in the blank? If we have a 34-year-old white female had a blank pregnancy as proven by the pelvic what? What would go in those two spots? Hello, 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 hello. Good to see you guys. Got quite a few popping in. We got 36 now and 12 likes on the YouTube. Don't be afraid. Go on and type in chat. Let me know what you think the answer is. All right, let's see. Where's atopic? She has an atopic pregnancy and ultrasound. All right, perfect. Well, I think. If we get something wrong, it'll say it's red and it will have a negative check mark. The specimen, right here, we're under the gross description. The specimen is a what? A right blank tube. What would go right there? Our Dr. Gibbs. Fallopian. Good. The tube was examined, revealed the presence of a fallopian tube measuring 5 to 2, and sectioning of the blank shows it to be what? What would go right there? Some people are saying tubes, some people are saying clots. I guess maybe clot would go right afterwards, right? Blood, and then the word clot would be in the second one. There we go, there's clot, and then tube in that one. Okay, good. And then the sections were taken and placed in 3 blank, A through C, for embedding. What would go in that spot right there? Microscopic or cassettes? Cassettes. Then here, the last two things, the microscopic description equals blank examination was performed. Was it pregnancy or microscopic? What's the next one? Pregnancy, microscopic. Microscopic examination was performed, and the ruptured tubal, what's our diagnosis? Our diagnosis is a ruptured tubal pregnancy. And a few things is, what I noticed here is the beginning of this one is a sentence, and see how it's capitalized, and all the other words that were put into this thing were lowercase. That would have been the only spot that needed an uppercase because it was the beginning of a sentence. So that's one cool thing about the word microscope. But anyway, just something different. We haven't done that in a while. We've got some other ones we can do here, like the parts of the heart and fill in the blanks and stuff that are pretty cool. But I thought this was cool because I like OB and delivery. I turned off the audio. That was the wrong thing. Let me close that. There we go. I've still got audio on. Okay, good. And right here, questions for tonight. Integumentary. All right, if we've got what two answers are you guys going to go to first? Just by looking at these answers, what two codes are you going to run to, or two answers are you going to run to first? A and C, the 143s, you see how the answer starts off with the same answer in two of the answers? So I would run to that 14301 code, check my header, not the descriptor, but check my header. If I was at 14301, where would I be? I would be under adjacent tissue transfer, which has a lot of different names. It would be like Z-plasty, V-plasty, rotation flap, random island, advancement flap. It could be bobbled, Romnans, all kinds. There's all kinds. Let me add. I figured out what was wrong with my camera is because I had it on many different things at the same time. So let me do this. Sammy, you be nice. There we go. So because these adjacent tissue transfers have so many different names that we can call them, what I did is I just moved them to the beginning of that code number. And the list of what those are on the previous page right here in the guidelines. So instead of leaving them here on the previous page, I just moved them over there to the first code. So hopefully that's helpful for you guys. So if we were doing that, I would see one of those words inside this code question. So then I would look at my code question and see if I am doing that kind of situation. Is that what I'm doing? Am I in the right header? Would I be coding one code or two? We do have the 116 in here just as many times as we have the 143. That is something to consider. So 116, 116, 143, 143. (116) is under the header of excision malignant lesions. Our 143 is under the header of adjacent tissue transfer or rearrangements. What header are we under? The 14021, still under the adjacent tissue transfer. Just making sure you guys can still hear me, right? Hey, Maisha. Good to see you. Hey, Robin. Is this what the fill-in-the-blank test would look like if it comes out? Probably not. That particular thing that we just did on the op note looks more like what they already do on the CCS exam. They have 10 questions at the end that have 10 answers, and you have to match the answers to the questions. So that was more kind of like what an ahima thing is. But if we have fill in the blanks on our exam for CPC one day, I assume there will be nothing, and we just have to go look up a code and put the code in from our own ideas of what we think it would be. That was more of a matching thing. Oh, she's also Bambi. She had to go move laptops so she couldn't see. Aw. All right. How do we tell what went on and what we're doing today and what we're coding for today out of this scenario? Are we a 116 or are we an adjacent tissue transfer? I know this is one, and I love integumentary and can do most all of integumentary questions really quickly and be 100% correct. But this happens to be one question that I know I would get wrong, because I would see this rotational flap and know that that's a name that is on that previous page for adjacent tissue transfers and rearrangements. And I would assume it's going to be one of my ones here under the adjacent tissue transfers, the 14s. I just need to check location. Where was our body part that we did? Left inner thigh. So the 021 would have been the wrong body part, right? I don't know, it says leg. Size-wise, what's the size? But irregardless, I would have been wrong. Because this one happens to be the oddball here with the 116 with the 13121. And if we go look at our 13121, that is under a repair complex. It's a reconstructive procedure. And the way they wrote this note is that they did a removal, which is an excision of a malignant tissue. I can see where that's our 116, right? And then it says to close surgical post excision repair. And you can see under repair complex, they call this a reconstructive procedure. and here they call it a reconstructive procedure. The fact that they have this wording, reconstructive procedure, down here means that if you see these words, then you know one of your answers is going to have to be a 13. But I for sure would have gotten this wrong because I have the rotation flap listed next to these 14 codes. I would have gotten this so wrong. So that's why, for anybody that's taking their exam tomorrow, if you happen to see a rotation flap with a reconstructive procedure, you know you need to code our oddball 13. Let's look at the rationale. I haven't read it because I don't know. I haven't done this question. I just know I would get it wrong. To see if there's anything here that helps to tell us why this is so wrong. I put this one up on my website too last night. So if you're part of the membership on my website, it's one of the new integumentary questions too. But I know I would have gotten this one wrong because in my notes I've got rotational flap is an ATT. Yeah, I don't know how I would have known. Maybe you guys know something more about the differences between ATTs and these complex repairs and then the malignancy removals. Why wouldn't it be an ATT? I guess because an ATT is just an adjacent tissue transfer. It is not the excision for the malignancy removal. And an ATT is just to repair a site. And that's the part that I'm forgetting, that this starts out with a malignant removal. And because we know, and you know I've taught y'all this, that we know right away that anything that is malignant is a 116, and that anything that is, what's my other number? Because my numbers are 114, is benign, right? I've taught y'all this. But then I don't know why when I put it into practice with this question, I get so caught up on this being an adjacent tissue transfer that I forget we did a malignant removal, and you have to do your 116 with that. It makes it easy. It makes it quite obvious that what the answer is here. If you remember, malignant removal is always going to be in the 116s. Don't forget that particular part. But I for sure would have gotten this one wrong. Absolutely. I probably would have picked A. I know I would have gotten it wrong. I know if it was on my exam, I did get it wrong. For sure. Next one, we've got a good guideline one that somebody has mentioned was on theirs. So based on guidelines, which statement is true about multiple biopsy techniques when performing the same encounter? A, B, C, or D. I'm not going to read them out because they kind of sound, they're easier when I read them out. So you guys got to get in the habit of reading it in your own head and figuring it out. You know how sometimes things are easier when somebody reads it to you than when you read it yourself? I don't know if that makes any sense, but I'm going to try not to be too helpful. but I can't help it. If that makes any sense. It kills my soul not to talk. It says ATT beside benign lesions, not malignant lesions. Includes benign lesions. Does it? That's cool, Marianne. ATT includes benign lesions and not malignant lesions. That's cool. I don't have that in my notes. I don't know why I associate adjacent tissue transfers with malignant ones. Why do I do that? It's just inexperience, I think, with them. I don't play around with these particular codes. I do a lot of family practice codes, and so this is more of a specialty thing that a special dermatologist or a special cancer doctor would deal with. But if these are for benign procedures, undermining grafts. Does it say it in the guidelines above adjacent tissue transfer in there somewhere? I'll look that up. Cool. I'll look that up and see. That's awesome. Thanks, Maisha. I did not think I was ever going to be able to find a zip file that could hold all of that data in one thing and then get it on my website and have it to where people could download it. I don't know. I hope it works. We'll see. But it's a lot. It's a lot. I worry about somebody being overwhelmed by all that. If you had to prep everything I ever wrote, ooh, Lord, I feel sorry for you, but it's super helpful. And y'all been asking me for 4 years for a bundle, so, I finally figured it out and got it. Maybe, if y'all want a bundle of just like cardio and lab and path or something like that, I can set up other bundles too, but hopefully that helps you guys out. Plus you can still use your loyalty or whatever on it, so everybody's saying A, B. It is B on this one. This one is B. I thought this would be very good if you're taking your test tomorrow and you need to know something that is true about multiple biopsy techniques in integumentary. Only one primary lesion biopsy is reported. That's a very, very, very important guideline to know. So get that written in your CPT book. Go to the page where the biopsies are. There's our little biopsy chart. I got rid of all the page numbers. In my book, I whited them all out. So, sorry, I can't tell you what page number, but it's around code 11102. And at the top of that page, write down only one primary lesion biopsy code is reported. Which is crazy. I know we've had practice questions where they times 3'd yesterday in pocket prep. A biopsy for a patient who had 3 lesions, but they said they did a biopsy and the answer was times 3, but I thought it was singular because of the way they spelt a biopsy. They didn't say multiple biopsies, but there was 3 lesions, and they didn't say that they put all 3 biopsies in one container or separate containers, whatever. All that stuff needs to be noted, but it's interesting. Right here we have that only 1 primary lesion biopsy code can be reported, but I know yesterday during pocket prep we had a ×3 for biopsies, but they had 3 lesions, so I don't know. It's very interesting, but that's a good one to write in your book, at least just these words, because if AAPC is going to pick a question, the answer is going to remain the same with the same wording. So that's super cool, super important. Page 85. Thanks. Never second guess. Never, ever, ever change your answer, and don't second guess. Pick an answer, stick to it, especially if it's a gut one, and walk away from the question. I got another matchy one that I wanted forever to put together, and I finally was able to put this together. It's super easy. Real quick, what's our hashtag mean? Is it A, B, C, D, E, F, or G? Try not to read every word. Try to skim these for key terms like telemedicine, modifier 51, another telemedicine, revised or new, FDA. That's what I do. I don't read these entire sentences. You don't have time to read the entire sentences. E, good. What about forbidden symbol? Modifier 51. Lightning bolt. FDA, good. Star. Who's the star of the show? We have 2. Ashley, double check that. A star means audio only. I know you ran with that telemedicine. That's the bad part about only reading just a portion of the sentence. Sometimes you miss important things, but there's nothing you can do about it. You have to not read every word of the exam. C, then we've got F, then our uppy down button, yeah, go cart. We had 2 telemedicine answers. The opposing horizontal triangles. Yep, B, perfect. Perfect. Robin and Ashley. And then we finish up with our plus sign is G, indicates codes that never reported alone. And the other thing that I got handed to me last night is that, you know, guys, I've told you that the codes that have the plus symbol are never coded alone, and that they don't have modifiers on them. Well, they can have one modifier. Does anybody remember what modifier that is from last night? What modifier can add-on codes have on them? There is one modifier. Good job, Passion. She was around last night where I had that epiphany, like, oh yeah, I forgot to say that. Not 59, Maisha. Because you don't need to report it as a additional procedure, because that's what the plus symbol's for. It's an add-on code. Nope, it's not 51. There you go, Passion. It's 26. So if you have a CPT code that has a plus symbol in front of it, remember to never, ever, ever, ever use especially 50 or 51 modifier. If you see that on your exam, you can eliminate those answers right away. Also, if one of your answers is standalone and only just an add-on code, you look it up and it's got a plus symbol in it and it's answer C, you know you can eliminate it because they cannot stand alone. They have to have another code with them. And if you have two codes and one of them's the add-on code, the only modifier you should see at the end of these two codes is your 26. For, like, if your physician is a cardiologist doing a cardiovascular procedure, but they're also doing a radiological procedure with it, so they're acting like a radiologist and a cardiologist at the same time during the same procedure on the same patient, then they do get the 26 modifier at the end of that add-on code to indicate that this physician is wearing two hats. They are being the radiologist and the cardiologist for that patient. So, pretty cool. This is just the answers for today. It's a little matchy. And then this is just the definitions from the CPT book on those particular icons. Here's a modifier. 1. Am I a 78, a 58, a 79, or a 76? Don't be bashful. Look up the differences between those modifiers. Look through this example for just those differences, and then type out in chat what you think the answer is. It's really good practice. What do you think the answer is? Did I mess you up, Ashley? What you need? Okay. Kitty cat walking across the keyboard. Hey, Mabel. Good to see you. Good job. Y'all are good on this one. Who was it that's having their exam tomorrow? I know her name when I see it. Would this be good for someone who's just starting out? I am trying to help a friend. Was going to get her to get started. Yeah, absolutely. Oh, you're talking about my big bundle. No, that'd probably terrify the heck out of her. She should start out, Marianne, I'm sorry. To answer your question, I just now saw it. What I would start her out with is, that'd probably terrify the heck out of her. Not that. This one? Can I get this one back up? That one. My website. Start her out with a CPT book. Have her Google, find one, the cheapest, just send her, with free shipping. And then start out on my website, have her join it, go to the resources tab, go to the CPT book prep page, and do the 8 pictures that I have listed here. They give you step-by-step instruction on how to prep your CPT book. Start her out with this. Then she can move on and do the anatomy pictures, and then she can do ICD-10, but continue watching my lives and practice questions and stuff like that as she's prepping the book. Start her out with this. If she likes medical coding and thinks it's fun after she does all these little steps in the book, and then wants to get into this, then we can talk about notes and stuff like that later. But start her out with free stuff at first. Yeah. And the big bundle, the big mega bundle, y'all, you can get it under Affirm or Afterpay, and I pay all the fees for that. They won't come after you for late fees or anything like that, or interest fees. I pay for that for you guys. So it's if you wanted everything I got right now in my hands, note-wise, besides the turn a 2023 book into a 2024, I didn't put that stuff in there. I've got the big mega bundle up. Good gracious, but it's a lot. It's more info than I'm sure anybody wants to write, but I do it every year for you guys, but it's a lot, but it'll help for sure pass the exam. But like this center picture right here that I have highlighted in dark, you don't need all the stuff that's written over the top of the code descriptor. You just need the one-word differences that's written right underneath the code for your exam. The extra stuff that I have here to the side actually tells you what's going on inside that code descriptor. You don't have to write all of that for your exam. It's just there in my notes for you guys. Since y'all are paying for it, I want to make sure that I give you some good value. So don't freak out if you do purchase what I got. You don't have to copy all of it if you don't want to. But it is super helpful. All right, let me figure out which one's my Word document again. I got to label these suckers. All right. Yes, we are a 78. Good job. This one I don't have an answer for. One of you guys emailed me this, and because it's a Mohs surgery, I thought we could do it together. I'm pretty sure I've already done it once, but it's been a long time. If we go to Mohs, it's super helpful to know how to do these, or Mohs, however you say the procedures, but I know them because they start out with the 173s. The first code is just body location, and we don't have to worry about that because every single answer is that particular code. The first thing you think about is that this code does include 5 microscope slides for the first stage too, which is cool. So the next code, and the only code that can go with it, is the 12. If you see 14 written with an 11, then you know that's a coding irregularity and you can't use it. The only time we would use the 12 is if we had 2 stages, and you can see right here in this little thing, we did have 2 stages. A stage simply means the physician went back to the body and cut something off the body again. The first stage would have been the first time they walked to the body and cut a tumor or something, a big chunk of meat off the body. The second stage would have been the second time the doctor returned back to the body and cut something else off again. This one does have 2 stages, so you know you are required to have the 12. So we can quickly eliminate C and A. Possibly. Wait a minute, I forgot that the 12 is over here. Why did they put the 12 after? Oh, I see what they did. They put the 12 after. Oh, it's in all of the answers. Ooh, okay, never mind. It's in all of the answers. This must be an ahima question, the way it's written. All right, so we do have 12, we have 12, we have 12, and we have 12. So each of them do have stage 2. When they cut the big parts off the body, they slice those body part, the big piece of meat or the stage that they cut off the body, they cut it up into little sections, or microscope slides is what they're doing. They're slicing up the piece of flesh that they cut off and putting it onto microscope slides. How many microscope slides that a stage cuts into is important. Each stage includes 5 microscope slides. Any number over that, and we have to code the 15 because that'll cover extra microscope slides. We see that stage 1 is a number 6, and that is over the number 5. We do not add these together. We don't add up our microscope slides. If stage 1 is 4 slides, then it's 4. If stage 2 is 4 slides, it's 4. It's not 8. We don't add anything together. So each stage is done independently. So if this is a 6 slider, we know we need our 15 to cover our extra microscope slide that 11 did not cover. 12 only had 2 slides, so cool. The only other thing we've got here is it looks like they've added a surgical prep code to a couple of these answers, and also B is missing our 15 because we know we have to have it because one of our stages cut up into multiples slides over the number 5, so we know it cannot be B, our answer, because we have to have 15, and we know it cannot be D because we don't have 15. So between C and A, we need to pick out an answer. Would we add that code to this procedure or not? Do you guys think we would add the 12? I think that's the surgical prep code, isn't it? 1, 2, where are we at? 1, 2, 0. Oh, they're doing the repair. It's not the surgical prep tray. I thought it was the surgical prep tray. I was just going off my mind. That is actually the code for a repair, a simple repair. I thought that was like the surgical tray code. Would we code a repair with a Mohs surgery or Mohs surgery? And that will let you know whether you are A or C. the 173. Ooh, let me turn on some lights. The sun done went down. Okay. 173. If a repair is performed, use a separate repair flap. Use a separate repair flap or graph code. I have that underlined here in our notes at the top. If a repair is performed, use a separate repair, flap, or graph code. In addition, down here, if we stop the procedure and do a diagnostic thing and have a pathologist come and back us up and do a reading in the middle of the surgery, it looks like we can add some biopsy codes and the consultation code to it with the 59 modifier, which gets crazy. I don't think you'll have anything with this on it for the CPC exam, and I've never known CPC to add or repair a flap or a graph to a Mohs surgery example in any of their practice exams or on the actual exam. I think that this example is for CCS and maybe more complex because of what they do. Normally what AAPC does is the normal body part you need to know. This was a chest or back, and that we had 3 stages. We had 1, 2, and 3 stages. And the blocks are the microscope slides. That's what they call microscope slides, where in our example here on the screen, they're calling microscope slides sections. So if they say a stage had 3 blocks, that's all you have to worry about for AAPC. 5 blocks, we do not add 15. Stage 3 had 3 blocks, we still do not add number 15. Another example I had with 8 blocks on the neck, first stage. You know you're going to have that 15, and the neck ends up being the number 11. We did not have a stage 2, and the times 3 is because how many slides did we make after the number 5 that goes into 11? We made 3. 5 minus 8 equals 3. That's still pretty advanced. Most of your AAPC answers will say the number 6 here, and they won't do a times. They just want to see if you know how to add the number in there. We can do more of these as soon as we finish these questions for today, if y'all want to do some more. I like my surgeries. What do you guys think is the answer for this one? I have some books too. Some people have CPT, ICD-10, and HIPICS in my Discord group for sale too. There's no like eBay fees or anything like that, and you guys just exchange money on PayPal or whatever and ship the books out. And don't forget to check my Discord group, because we have a room there where people are selling their used books, and you might find quite a deal in there too. Yeah, we can do more Mohs. Let's just finish. I only got a couple of more questions, very few. When a physician performs a left catheter, passes it from the left ventricle through which heart valve? Aortic? I don't think anybody got that one. When the left yep. Catheter advances across the aortic valve into the left ventricle. We're going from the aortic into the left ventricle. Anybody know what MIPS stands for? There was a question recently on somebody's exam about a pass through modifier. What you will see on the exam is going to be a little chart that'll go along with it. They'll have like some CPT codes here. They'll have some modifiers here. And then they'll have either the numbers 1, 0, 1, or maybe even 2. Something like that. Only pick the answer that has the 1 modifier with the CPT code. So anything that's a 0 or a 2, don't pick those. Pick the one that is 1. Advanced kind of billing question. I'm not sure why it's on the CPC, but for some reason it is. This one is our merit-based incentive program. Yes, yes, yes. Coding professionals may assume a cause and effect relationship between hypertension and which of the following complication? Is it heart disease only, kidney, both, retinal? Good Lord, I hope y'all can hear me again. All right, good. Thank you, thank you, thank you. Thank you, thank you. I just got a message from Twinkle because I just now looked at my phone and it says they can't hear you. But I look at it an hour later. Thank you much, guys. All right. Indeed, we've got C. They may have this question in reverse. Which one is not a cause and effect disease? So be careful. Make sure you know that they are looking for an actual one or They may say the word may not assume. So be careful with this one. Make sure it says may assume and not may not assume. What about malignant neoplasms for the lymph node system? The fifth character refers to what organ? Inguinal, head, axil, or pelvic? They didn't come with answers? Yeah, I'm a little slow, Twinkle. Sorry. I wonder which one. Which one are you looking for? Let's see. My downloads. Oh, Lord. She's looking for the answers to the heart PDF. The heart PDF. Fusion. The anatomy and physiology chart. Nail, dermatology. No. That one's going to be arteries and veins. What's the name of the document called? Arteries and veins. That one's got answers on it, so it's probably not that one. Of course. Heart labeling. I wonder if it's that. Oh, the heart labeling one, the one with the big picture. The heart labeling one, where am I at? This one? This one, if you download it in PowerPoint presentation, you have to put it in slideshow view, and it will tell you the answers or something here as you do something. Come on, go back. Oh. See how it's filling in the answers? It'll do the same thing here. If it downloads into, the answers are on the second page, of course, but if you do put it in presentation mode, it will fill in the blanks too, somehow or another. It will fill in these somehow or another. But you can see how it's going and flowing, and showing you how it's, where the blood is going and which route it's going, and then it'll highlight the different colors of where it's at in the body at that particular time, and then it'll fill in the blanks here too of where it's going. Right atrium to that right ventricle we just talked about, and then it'll fill in the other ones too. I don't know. And then, of course, it has the answers on the back side. Oh, Lord. I don't know if I can I get rid of that? Where am I at? Get rid of that. Did y'all see any of that? I'm not even sure. I hope y'all did. Did anybody get the answer to this one? Yes, download it first and see if that works. If it doesn't, let me know. Got 39 of you guys on and 25 likes. Oh, I forgot about the memberships. Y'all gotta, it's been, y'all gotta remind me. Gotta remind me. Let's give away some memberships to YouTube. Let me send YouTube some money. Yes, yes, yes. Go, go, go. Oh, I gotta change my credit card info. I lost that credit card. All right. Kelly, Danny, Daniela, SK, and Victoria. Yay! I hope that is super helpful, guys. Sorry, I forgot about that. This would be in your ICD-10 book, is where you would find the answer to this one. You can go to your ICD-10 pages right here. You can go to that C81 and it'll give you the definition of your 5 characters right there. Did anybody get the answer to this? I give YouTube the money. I don't have any control on who gets the prize. YouTube picks the winners. I wish I could individually pick them out and say, yes, you can have one. I don't have any control over that. Just make sure that you hover over that gift box where in chat it shows that I'm giving away some memberships. And you'll see the little gift boxes on the side of that green box. When you hover over it with your mouse, that blue box with the little star and stuff on them, you'll see 3 dots that will pop up. Click on the 3 dots, and if you have not already automatically opted in to being able to accept gifts on YouTube, that option will be there for you to click it. A lot of people don't have to do that. It's not there, so don't worry about it. If it's not there, then that means you will be entered in to win the prize. But a few people have their settings locked down that they need to actually accept a prize from YouTube. But that's the only thing you got to do. I wish I had some control, but I don't. I just send them money and then they do whatever they want with it. And then they pick the prize winners. Apparently it's if whoever's chatted a whole bunch, so I hope so. Thanks, Sierra. Hey, Joyce. I hope this is super helpful for you. Did anybody find the answer? I'm still looking. Did anybody mark A, B, C, or D? Oh, I've got a couple of A's. You are correct. It is inguinal. Good job. Perfect. Neck is 1. All right. A list of codes describing procedures that are exempt from the use of modifier 51 can be found where? This is a huge time saver for you guys, because if you get that question that is which of these 4 CPT codes is modifier 51 exempt, instead of running to each one of the individual CPT codes, you can run to the appendix because they're in numerical order and find the one that's on the list. It's a very small list. Do you know where this appendix is? Also, if they ask you which code is FDA pending approval, Don't run to each individual code. There's also an appendix to that. You can run there. They're in numerical order, and you can pick out the answer in a fourth of the time than it would take to look up each individual code to see if it has that lightning bolt or the modifier 51 exemption. Correct, Appendix E. So don't forget about utilizing these tomorrow on your exam. Which of the following removes urea from blood through nephrons? Did Maggie ever figure out her YouTube thingy? Kidneys, perfect. What does HIPIC stand for? What does MIPS stand for? Those kind of things could very well be on there. There's usually questions about the date that things go into effect or the date that they are released. There's two different dates. HIPICS has like quarterly updates, not just yearly updates. Be sure to know those differences. That's kept up in the front of the book. There's release timeline and then the effective date timeline are two different timelines. Lots of codes can be released in April and July, or they come in effect in April or July, not just October and January 1st. Be sure you pay attention to those questions, nuances when you're taking your exam. HIPICs are updated quarterly. CPT codes, category 1, 2, and 3 are updated annually, but release dates can be anywhere from August, January, July, April, lots of different dates. And then the effective date can also change from January to July or April or October. So be careful and make sure you know exactly which one they're talking about. When you're doing these codes, don't let them trick you on simple ones. ABN will definitely be on your exam one way or another. Some of the questions are super easy, and some of them can be difficult, especially when you're looking for an incorrect answer. What do you guys think the answer is for this one? When are providers responsible for obtaining an ABM for services not considered medically necessary? Yep, B is it. Perfect. Other things you should know before tomorrow. I didn't have time to find these questions for tonight before I had to come on live. Had to work today. But oocyte retrievals, tunneled versus non-tunneled procedures, and then some of your eye stuff. Be sure you know a little bit about some of those particular coding situations. But we can do more Mohs questions. I can come up with some of those off the top of my head, or we can look at any other set of coding stuff. I didn't even bring up any E&M questions. I can go find some real quick. Whatever you guys want to do. What's this? What do I have here? Oh, that's a bunch of guidelines. I was trying to feed this in, and that's not going to work. That's not questions. What did y'all want to look at? Where would you find an answer for these questions pertaining to C81C in your ICD-10 book? Let's see. So they asked us about where is my camera? Here we go. Ooh, that is not what I'm showing right now. Hold on. Let me delete this. Delete, delete, delete. Yes. And then let me add video. Video. Yes. All right. So, here in our ICD-10, if you go to any code with 5 digits, 1, 2, 3, 4, 5, the 5th digit is separated by body parts: head, thoracic, abdominal, axle, upper limb, inguinal, and it changes by every single one of those little numbers, the 5th digit. 0 will always be unspecified. Even if I change my number from 2 to 3, number 1 will always be face and neck. Face and neck. 2, Hopkins. 3 is always going to be abdominal. 3, we can go down here, be abdominal. It's just a pattern with any code, no matter what, where you're at, that the 5th digit does the body parts. And that's what they're talking about. They want to know if you know that the 8 is always multiple sites. If you know that 9 is a solid organ. Kind of funny. Same thing in one of the ones that I talk about all the time about the 5th digit. If it's this, you know that's your answer you're looking for. What is that situation? It's the drug allergic reaction one. That the 5th digit, if you see that, I can't even remember what the scenario is off the top of my head right now, but it's it's an X or something like that, I forget, but that's always the answer, is when that 5th digit changes. So that kind of stuff is super fun. I love writing up all the different guidelines. One of the things I bundled up today in that big bundle was all the guidelines and stuff that I did for ICD-10 for like sepsis, and I just pick a page that is super close to all the sepsis diagnoses and then write all the guidelines on that one page. Same thing I do for like cancer. If we have a bunch of different guidelines for anemia, when they have cancer, that kind of stuff, moving it all to the first page in the cancer diagnosis area, it's super helpful to do that kind of stuff, I think. Moving it to the codes. Anytime you can have a guideline that you know something is never coded first or whatever, just move it to the actual code. That way you've got it written right there beside the codes. That way you don't have to remember it from being over here in these lovely guidelines. Just work your way through it. If they always say it's never coded first, then you can go through the entire book and write never first. That way it's there. It's just one little tip while I'm sitting here in the ICD-10 book. But hopefully that helps you out for learning about that 5th digit. Does that make sense? Yay! Awesome. Yeah, the adverse effect. What is our 5th digit? I forget that one. Go to bed. Absolutely, absolutely. I have gone over everything that I can remember that was important, that I wanted to make sure you knew for your exam tomorrow. Best of luck, best wishes. If you're still coherent tomorrow afternoon, come see me on TikTok and let me know how the exam went. Hopefully no surprises, and just keep me on your shoulder tomorrow. Keep moving, keep moving. Best of luck, best of luck. 1 times 5. It's the 5. You're right, Mabel. If the 5 is in the 5th digit, yep, that's the correct answer. Yep, 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 yep. Tamlin. Okay, good. I got her answered. So do y'all want to do integumentary or want to do E&M? What kind of questions do y'all want to do? I even have some cardiology we can do, probably. What's this one? This one is, that's sinuses. E&M. Okay, let me see what I can find real quick. That's a 76 modifier. 78. E&M. I just love my silent keyboard and mouse. Y'all, I'm sitting here typing and clicking away on a mouse like crazy right underneath this microphone, and y'all can't hear a thing, I don't think. It's amazing. I just love it. After, I don't know, 15 years now of doing desk work with a keyboard and a mouse, I can tell you I'm sick to death of hearing myself clickety-clack all day long on this keyboard, and I'm so happy to have found a way around all that noise. I tell you, so tired of it. All right, let's go here, and I am clickety-clacking, and it is silent. Love it. Love it, love it, love it. All right. Come on, open up. Do you guys know the differences? What CPT codes are for whoop, that's not right. That's for our pop-out chat for today. For an emergency room, type A equal which codes, and then which codes are for ER type B. We have two types of ERs, and they're both billed differently. Do you guys know that? Did you see that in your study guide? The major important thing about that is that they have to be open 24 hours, 7 days a week, for sure, to be a type A. And then your type B and that's your 99281 through 99285. And then your type B are what codes? Those are HIPICS codes. Yes, we can do some critical care. Critical care. What is our answer for a patient who has critical care services for 125 minutes? What is going to be your answer for this particular patient? This would be more like what it is when it's fill in the blank. If they ever switch the exam, this is what they would have. It's just a scenario, and you got to tell them what you would code. Anybody know what the code is for this one? Good job, Kelly. What if you did intubation? What would happen then? Then what? Mm, 125 minutes. Okay. What if we had 105 minutes with intubation? What would be your answer? Sorry, I'm switching it around on you. Is this your same answer? Would we add something to it? Would we take something away? What would be your answer with this? Marissa. I almost called you Marisol. I probably have. Hey, Monique. Go-kart, you got 2 years of me. I'm sure you've heard it all from me. Even when I'm confident on the answer, I still get it wrong. Oh, don't worry. That's perfectly fine. Yet we can do some cardiology. So, if we're going to bill for intubation, which is our 31500 code, oops, my computer's about to crash, is not happy with me. We're going to bill our intubation, so we got to have that code, but we have to take the time off of critical care to do the intubation. So that's going to take our critical care time down to 100 minutes to bill for this intubation. We can't get paid critical care time, and we get paid to do the procedure by adding the code at the same time. That's double time. So we'd probably end up taking away this ×2, right? If we only have 100 minutes, then we probably only bill these once here, and then this one. So just be careful when they add intubation. You can add it to critical care. You just have to take the time off of the total time of critical care. Wish I knew exactly how much time to take off, but you know, each doctor is different on how much time they take, I'm assuming. I still have 39 of you guys on and 32 likes. That's awesome. And 5 new members tonight. That's wonderful. There's a document that every Medicare patient has to have if they come to observation in the hospital. Does anybody know what that document is? What the name of it is called? That if you admit a Medicare patient into the hospital for observation, for like post-op surgical care after surgery, and they're not coming up out of anesthesia in the appropriate time, and you're just going to have to observe them for longer than normal, and you are going to put them into observation in the hospital, which is allowed, but they are a Medicare patient. Do you know the form that has to be filled out? Medicare OBS equals, we just had a total eclipse of the moon. So it's called a moon document. So just so you know, if you ever see that question, there is a document that's called the moon. It is a Medicare outpatient observation notice. Simple as that. And that is what you have to fill out if a patient is going to actually end up being billed for observation. They do meet certain criteria for it. Even though they're Medicare, you can bill for it in certain situations. Just don't forget about your MOON document. All right. Cardio. That's hip picks. Oh, you know, that was on somebody's exam recently. Something about a wheelchair on somebody's exam recently. So I'm just going to grab this question since it's there and it says wheelchair. I do have A, B, C, and D for you. But it won't put A, B, and C, and D there, but you guys know where A, B, and C is. Which one of these would you report for 2-leg strap for a wheelchair? This next one will definitely be on your exam, one way, shape, or form. It's always on there. The answer for this one is that one. The red ones are the answer. High risk colorectal screening. What makes a patient high risk can be simple as history of polyps. That personal history of polyps can put them into high risk. I've seen that question on the exam too before. And it's versus that or whether their uncle had history of it, of colorectal cancer or something like that, or their sister or something, versus polyps. And polyps is the answer that they were looking for. But irregardless, this patient, see if I'm missing anything from the question. This patient also has Medicare. That would make a difference for this question. You remember seeing triage on the exam? Well, that's news to me. I've never heard of that. I will find it out though. Let me look. Y'all know the answer to that one? Which is B, not D, B. Okay. Which one of these is the definition of triage? Still got 29 of you guys on. Indeed. It's just A. That's the only thing I see right off the top of my head that has ever been in part of their course. Was just this. Did you see anything different? Let's see. Oh, this one's a good one. Lord, the amount of work that goes into prepping just one question for you guys is crazy. All right, that's answer A, that's answer B, that's answer C, D maybe? I don't know. That looks multiplied. None of the above. None of the above, maybe? There we go. Two different doctors working on an 18-year-old male. What do you guys think the answer is? Ooh, I got some cases. They're big though. What do y'all think the answer is for this one? I still don't see a correct answers. Yes. Don't stay up too late, Bambies. We're going to do 10 more minutes and we're all done. Best of luck for tomorrow. If you remember anything else on the exam, let me know. Love it, Mabel. That was awesome. This one, the answer was A. Because each doctor did a different procedure. They didn't work on the same procedure together. Dr. A did an open treatment of a fracture with plate and screws. Dr. B did a complex closure. Two totally different procedures. There's no need in having any 62 modifier or anything because they did separate procedures. It was a trick question, so don't let them trick you. Don't assume. Yep. Don't look for things that aren't there. Oh no, I don't want it to look like that. Let's do it this way. Okay. This one is a case. Unfortunately, it's a nightmare. Let's see. We have 60-year-old patient, fell on some water. There's her past history. This is her physical. Her imaging, her impression. Has a hip fracture. Number 1 is that. Number 2 is this. And then their plan is to do this. What's the question asking? The question is asking what E&M category is reported. Are we, where at? Where are we? Are we in the hospital? Are we at a doctor's office? What's the category of E&M we would bill for this visit? Can be found right here. What category are we billing? What kind of hospital visit? Are we doing observation, initial, admit and discharge, OBS? Are we doing just discharge? Are we doing a consultation? What are we doing? What kind of hospital category? If you had A is admit, B consult, hospital, C office, consult, you had D OBS, which one would you bill? This one's actually a hospital consult. Oh, sorry. This is our inpatient consultation. You see how the doctor down here wrote about I was asked to consult, blah, blah, blah. It says also up here that the patient was admitted last night into the hospital. You know you're not doing an admit hospital today if they were admitted last night. The closest you could get was subsequent hospital visit, and I don't have that listed up here at all as a subsequent. And then you've got the doctor noting in the chart saying they were asked to consult. And there was a decision for surgery too, but this one is. And he writes the note back to the admitting physician, thanking that physician for allowing him to see the patient. It's all a consult. This one, what level of consult would we be for this particular same patient? Would we be a 992? What are our inpatient consultation codes? Do I do just an X? I think I just do an X here. They are 2255. Is she a 99254? Would she be a 99253 or a 99252 based off of MDM? She has, you don't have MDM or time noted, so you have to go over her chief complaints and why she came in. She has a chronic condition, the osteoporosis. She has an acute issue, you know, the fracture. Her risk, because we've got decision for surgery, and her age. What would their overall MDM be? Would you bill? Oh, I did the wrong code, huh? It's supposed to be 2. Gotta watch me. If you had to do this on your own, what do you guys think? Julie's bailing. Oh, thank you for breaking that. Oh, okay, that down. Okay. Good info to keep in mind for the test. It is. Everybody going B for the 4? So this consultation has 2 elements that meet the level 4. It is an inpatient consultation. Our problems addressed were moderate because she has an acute complicated injury. The amount of data that was reviewed was just minimal, just the one unique test, the x-ray. But the risk of complications to the patient is moderate, even though they spelled moderate wrong, because they going to do the surgery, of course. So that's why it is a 254. Yep. We could go into external causes and doing diagnosis codes for it if we felt like it. Let's see. Do they have another one? Another one. I hate these. I hate these with a passion. These are the worst for me. I hate doing them. I really do. So this is another one. Are you 99202, 99203, 204, oops, sorry, or a 99203, 205, and you do not have MDM or time. And it is generic left knee pain. I hate these. These are the worst to do. I always get them wrong the first time I ever do them. Current meds and past medical history. We'll divide that up. Review of symptoms, family history, social history, physical examination. Let's separate that out. And axillary studies. And the impression. Sorry. Be sure and let me know where you need me to go. But I need to know, are we a 99, 202, 203, 204, and 205? For left knee pain secondary to underlying primary osteoarthritis. So I guess we got a chronic, right, with the arthritis. We've decided to do joint lubrication, which is an injection, I think. Therapy, physical therapy, and comfort to allow slight restriction in that, and that's it. Don't go up any more stairs. We can scoochie on up because you need to know the data that was done. We did an AP lateral and sunrise view of the knee. Revealed some calcification, decreased joint space, family history, physical history, significant hypertension, diabetes, thyroid disorder, history of a stroke, and cardiovascular disease. Whew. How old is this patient? 67. But the only decisions we made today was stop climbing stairs and go to physical therapy. So how would you bill this? I hate these. I get these wrong. Y'all are all saying 03? The number of complexity of problems is definitely moderate because of the chronic condition and an exasperated exasperated chronic condition. So we've got moderate for the number of complexity of problems, none for the amount and complexity of the data reviewed. X-ray was ordered, but it's being billed by the coding people, so we can't count it as MDM. Always forget about that. And then the low risk of complications, the doctor didn't do anything other than send her to physical therapy. So that is very low to minimal, and that means it is coded as a 99203. You did get it correct. I would have gotten it wrong, I think. I don't know if I would have picked an 03, because I see all that other mess they have. Oh, Lord, she's sick. But good job. Y'all did better than I would have. I hate these and struggle with them. Just a silly knee, but then they have all this other stuff going on with them. Good job, good job, good job. I would have totally gotten that one wrong. The rest of these are orthopedic procedures. remember that a 20-year-old coming in for a UTI with no other comorbidities, they have no hypertension, nothing else going on, we order a UA, send it out for culture, we write an RX for antibiotic, that can be coded at a different level than a 40-year-old UTI with history of diabetes. We still do a UA and write an RX for an antibiotic, but they're both coded at two different levels because of the chronic disease factor in those. So when you see that during the exam, sometimes this ends up being even a 99202 because the RX is the only thing that's moderate, but the UA and the no data are both minimal to none. So you can go as low as a 202 with that, and then this one can be as high as the 99204 on that one because of the chronic disease process with the RX. But you know, I've also seen this one as a 203. The 92988, no, that's not the number I'm looking for. 29880, yeah, 880. Is that right? Yeah, it's supposed to be a 2 though. 2 versus the 29881 will be on your exam, and these are kind of tricky sometimes. The description of the procedure is where you want to focus your concentration on to look for the particular part of when they go in to the medial or lateral side and what they do to the medial and lateral side, so you can figure out if you did both sides or not. Remember that your route into the body is usually done on the good side and you fix the bad side, but remember to look-see and see which one you actually did a repair in. A lot of times they just go in there and they look around and they don't repair anything. 298. These will definitely be on your exam because they want to know if you know the difference between or and. Simply. Do you think you did an 80 or an 81 with this one? Sometimes your procedure list can have multiple things listed, but you may not have done it once you got in there. It's like a preoperative list or something like that, so be careful not to pick that if just because it's got it listed doesn't mean you might have done it. Be careful and read your note in here and make sure you did do both sides. We did have a lateral menectomy here, and then we have a medial menectomy on this side. If you see those words together, then great. You did both sides, right? And you know you can code the one with the both. So that's all I look for is the actual, that word, and then look for it to say medial, look for it again, and look for it to say lateral. And that's lets you know you can code both. But be careful of the listing it. I know, it is a lot of words. But all you're looking for when you're doing this word, these two codes, or, you know, you can do the 82 or the 83 too, is you're only looking for this word. So you're not having to read all that mess. Don't let it freak you out. You just need to go hunt for that word. And then you see if you did medial or lateral. It takes playing around with them too. Got to play around with them. You can just go off the list and hope that that particular question is correct with its little list that's up in the top part of the note and move on to your next one. Whatever you do, don't spend a lot of time, no matter what. And just decide whether you're going to trust the list at the top and pick it as both, or decide to do a search for that word throughout the body of the note, and then just look for medial or lateral right in front of it, not around it, but directly in front of that particular word. Because they'll do a lot of stuff in here that's medial and lateral and posteriorly and stuff. You see laterals down 10,000 times, but it doesn't matter unless it's this word. Yes, no second guesses. Well, I hope this was helpful. I know that people that are taking their exam this week, tomorrow, whatever, will have seen some of these questions that we went over with tonight for sure on their exam. So I hope this was super helpful. If it's not something as simple as MIPS or HIPPICS, acronyms are super helpful to know on the exam. Knowing where these appendixes are for the 51 or the lightning bolt, that is super helpful in a time-saving thing on the exam for sure. This heart disease one and the relationship between hypertension, yep, that's going to be on there for sure. My pulmonary valve was the one that was on my exam. This question is the aortic valve, but I had the pulmonary valve question on mine. Mohs, whatever you say, they're going to be on your exam. 78, 76 modifiers for sure on your exam. Yep. Guidelines about only primary biopsy lesion is coded. That's a very good question on the exam. And then this one that we went over, I know I would have gotten it wrong because I would have actually seen that rotational flap and known with my heart and soul we are an ATT. I would have picked A because you code it by itself with nothing else, and I would have went on with my day. I know for a fact I would have gotten this one wrong. But what we actually did was a malignant removal. And that is always what I've been preaching to you guys for years, is always our 116. So, super helpful questions. It's just hard to calm your brain down enough in the midst of this stress of taking this exam to notice these little things, because I would have, in my haste, seen that rotational flap and for sure picked A and moved on with my day. Would have never thought to stop and look to see if it was a malignant removal. So, super helpful tips. I wished I'd have known before I took the exam. I mean, I'm glad I passed, but super cool. This might help out for those that are super close with that 68, 69 test scores. These little things might help out quite a bit. And on the wordy questions where it's a guideline question that's wordy like this, make sure you're not looking for an incorrect answer, like which one is not true, because those are harder to answer than you realize when you're trying to look for an incorrect answer. So super helpful. I will be back 2 more hours on TikTok tomorrow night, and we're doing 2 hours on Thursday night here on YouTube, and I have a workshop this Sunday. It's my birthday. It's completely free for you guys. We're going to do 75 questions in 3 hours over my very best, and I know they're going to be on there questions. So come hang out with me on my birthday if you can, and we'll start at 2 o'clock on Sunday. The link is already up on YouTube, so you guys can replay it all year long, but if you can't stay the whole time, but I hope to see you guys. I'm still prepping questions. I started the document yesterday at least, so I'm working on it, but I gotta go finish it for sure. But I have more fun hanging out and playing with you guys. I tell you, that's my downfall. Oh, don't freak out. My cases are the easiest ones for me to do, I think. I love the cases. Cases are the easiest. Turn your brain around, and whether you believe it or not, say it to your brain. I love the cases. The cases are the easiest ones. They usually are for me, especially since they have the list of what procedures they're supposed to be doing at the top, which I just go over and verify that CPT code goes with that little list that they have in the top, and I don't even worry about the middle of the case unless I for sure know what the heck I'm looking at. If it's a procedure like a laminectomy or something that I know nothing about and I'm not sure, I'm just going to go by the list of the procedures they said at the top that they were going to do and just pick the codes and answers for that and let it go. Don't worry about it. No stress. If it's something like this and an or for the meniscus repair, I know exactly what to look like inside my note of what the surgeon looked for, to look for that medial and lateral. And if, I can run to the middle of that note and look for it because I know exactly what to look for. If you have any hesitation and you don't know exactly how the procedure is performed and what you would look for in the middle of the note, then don't even bother. Don't even worry. Just use the list at the top and you'll be right, 80 to 85% of the time, maybe even up to 90% of the time, and that's good enough. Don't worry about it. There's plenty of questions there for you to stress over. Don't worry about those cases. All right, guys, I will see you tomorrow night on TikTok, I hope. We will do some more pocket prep questions, okay? 6:30 Arizona time zone, earlier if I can get to it, okay? I love y'all, proud of y'all, and I hope this was helpful, and I will see y'all tomorrow night on TikTok.